Does acupuncture hurt?
Acupuncture can hurt. It's true. It can hurt, especially with somebody who actually has not gone to school for Chinese medicine. So the important thing about, that's a technique that we're using, but when you're taught Chinese theory, you have a broader perspective of what exists. So it's not just physiology and anatomy. There's also the energetics of it and the emotional component and the spiritual component. So when you're educated about that, whether it be through lecture or Tai Chi movement, pulse diagnosis, you become a better listener and you become more sensitive. And so you start to be able to really listen to your patient. And you also learn these techniques for, basic Chinese medical school is 4 years for a master's program. And doctorate programs another 2 years. So there's time well spent, or they call it gong fu. So time well spent that you're learning how to do it. So when you start to do these things, you're doing them in a way that you've practiced for so long, and this has been handed down through the generations, that it doesn't have to hurt. And there's different types of acupuncture. There's a style like more Korean, or there's Japanese. Japanese style, typically in my experience in taking at least 2 modalities in my doctorate, is the use of very thin needles. You have to do it more often, but it's very thin needles that some of them you might not feel, and they typically will always use a tube. And so it elicits a similar response. Chinese acupuncture might have more of an energy boost to it, that someone that in a healthy body doesn't have a problem with. Once you get used to it, and there's a good dialogue, and the person has very good technique, and they have actually gone to school for Chinese medicine for at least 4 years, it's a very different experience than getting needled by someone that maybe has a 100-hour program or 27-hour training. That's when you get into the dangers of hurting someone with a bruise or throwing off their body energetically.